Happy Friday! It's Nicole here from Bryn Develop Podiatry in Canberra in Grantona Clinic, and I just wanted to talk to you a little bit today about shockwave. So we've been having some really good results with shockwave therapy. You can see the machine here, which we have the Swiss dollar class machine, which is the bee's knees machine, and what we are mainly treating is heel pain at the moment. So some people are coming in with pain right on the bottom of the heel here. Others it's a little bit further forward, and sometimes it's more that plantar fasciitis, which is the tendon that runs sort of all the way along the foot, so the arch of the foot. The other thing we're using it a lot for really successfully is the Achilles tendon. See the Achilles tendinopathy, where it comes down, your calf muscle comes down, it attaches into that big, thick, fibrous Achilles tendon and into the heel. So we're getting some great results with it, and there's no needles. So if you have a needle phobia and you don't want to be dry needled, then this is great. So basically, what we do is we do a screening, so we need to work out that it's appropriate for you. Now, we have had a few people come in recently who have had cortisone injections. If you've just had a cortisone injection, well, in the last 6 weeks, if you've had a cortisone injection, you cannot have shockwave. Don't let anyone tell you you can, because you cannot. And we have had a few people come in who have had cortisone and then someone has done shockwave on them at another practice, and it's a really big no-no. So just wanted to make you aware of that. Cortisone is definitely a last resort, and shockwave should be tried before cortisone. We have a massive tool bag of things that we use with heel pain. So if you've tried your orthotics and your stretching and your special socks, and you do your spiky ball rolling, and you've tried all these things and it's still there, then shockwave is definitely for you. We don't use it so much on a heel pain that you might have got last week, or you sprained your ankle or something like that last week. It's not really used for those acute sort of injuries, but it is definitely for those chronic ones. And we are getting a lot of people who've been suffering with heel pain for years, like a long time, and it's just this it's this really annoying thing for them. It affects your lifestyle. You can't go walking around the lake with your friends. It's even hard standing up at a party, at a cocktail party, because your feet are just throbbing the whole time. So if you know someone who has chronic heel pain and they just can't kick it, excuse the pun, then make sure that you get them to jump on the phone with us and we can screen them. Ask to speak to a podiatrist regarding shockwave. We can screen them on the phone and see whether they're an appropriate candidate for it, and if they are, we can book them in. We usually do weekly sessions, 3 to 5 sessions. So the initial session releases natural opioids and you get this, it feels great straight away. You stand up and it feels amazing. And then over the next few days, that inflammatory process is kicked in, the metabolism's kicked in, so it does get a little bit sore after in the first couple of days, but then after that it starts to get better again. And by session 5, we're seeing some really, really great results. So Achilles tendinopathy, heel spur syndrome, plantar fasciitis, anything to do with the arch or the heel, this part of the leg. The other thing it really works well on is ITB, iliotibial band down here. This is a really thick fibrous band as well, so it really gets in there. Patellofemoral stuff, so at the front of the kneecap here is another good use for shockwave, but the main things we use it for day in and day out is heel pain and Achilles pain. So if you want to learn more, pop me a little note down the bottom and just say more info please, and we can send you out, either PDF email you out our brochure which has everything on it, or if you would like a nice little package in the mail, we can actually post you out a real one, which is super rare. So hope that's been helpful, and please come forward and ask lots of questions. All right, have a great Friday and an awesome weekend. Bye.